though. When work is done, it's done. Close that laptop. And if you're not, I work from home, so I have to do it while I'm going down the stairs. It's not quite the same as when I was driving home. And that was my time to, once I got out of the car, I was no longer at work. So now I have to be, once I get to the bottom of the stairs, I'm no longer at work. So having some of those, those markers that say, when I cross this marker, when this time hits, I'm now off work. Some of the relaxation techniques, of course, then is that progressive muscle relaxation. You can build in that breathing exercise with it, and do some mindfulness all in one. So those 5 minutes can just be packed with lots of goodness. You may want to use some psychoeducation with your clients that really focuses on the science of work-life balance. And we really talked about that at the beginning today. And when you really start to look at the effects of not having work-life balance and the stressors of work and what that does to us in our bodies and in our mental capacities, it really has a lot of effects. So really helping to educate your clients on the physical and mental health risks of chronic work stress, such as burnout, hypertension, and strained relationships. You can also help them with the work-life balance strategies. So sharing research approaches such as the benefits of consistent routines, social support, and intentional downtime. Help them to develop those healthy boundaries through boundary mapping exercises. These are some of my favorites, the boundary mapping exercises. This is when you work with your clients to identify where they feel their boundaries are being crossed, and then help them develop the strategies to reinforce their boundaries. And assertive training goes right along with that one, because once you realize that you are crossing those boundaries and you want to no longer do that, you might have to be a little bit more assertive. So help your clients learn to communicate their boundaries effectively with supervisors, colleagues, and family members.